This is the second of the two lower limb anatomy tutorials. In the first one, we looked at the nerves within the leg, the femoral nerve, the obturator nerve, and the sciatic nerve and their various branches. We also looked at the arterial supply of the leg, the venous drainage of the leg, and we looked at the muscles around the hip, flexors, extensors, adductors, and abductors. And so we're going to pick up again on some aspects of the muscles in the thigh and upper leg. First of all, the anterior aspect of the thigh. So the two muscles labelled here are sartorius and rectus femoris. Now, sartorius is a long muscle, the longest muscle in fact in the body, which arises from the anterior superior iliac spine and winds gradually more medially over the front of the femur, covering over part of the femoral artery before joining other muscles to form the pes anchurinus and inserting in the proximal part of the tibia on the tibial condyle. We've already met rectus femoris when we were talking about the flexors of the hip as it arises from the anterior inferior iliac spine, and we'll look at a picture of that in a moment, and that combines with the other three parts of quadriceps, which all ultimately insert into the patellar tendon, which can be seen here as it attaches onto the patella. These two images of the femur from the front and from the back show the areas of actual insertion of the three parts of quadriceps that arise directly off the femur itself. This image shows the pelvis with the anterior inferior iliac spine picked out. This point is very close, in fact, to the hip joint, just superior to it. All parts of the quadriceps are innervated by the femoral nerve L2, 3 and 4. We talked about the adductor muscles in the first tutorial about the lower limb anatomy, but we'll just focus on it a little bit more. And here we see in the left-hand image the main adductor muscles. There's three of them that attach onto the femur, plus gracilis that goes to the tibia, and there's quite a lot of bulk of adductor muscle power. The adductor magnus in particular is a big muscle, and if we look at this image, we can see adductor magnus stretching all the way from the upper femur right the way down to the distal femur to the adductor tubercle. Notice as well the tunnel just about 2/3 of the way down the femur that the femoral artery penetrates through. Anterior to adductor magnus we have adductor brevis, which is at the top towards the upper part of the insertion of adductor magnus, and then below that we've got adductor longus. And then not shown in this picture, of course, we have gracilis that runs, as I've said a few times, all the way down below the knee and joins sartorius as part of the pes anchurinus, and we'll come to that shortly. In the right-hand image, we've got the back of the thigh, and we can look at the hamstring muscles. So first of all, focusing on the muscle that runs from the ischial tuberosity laterally to insert in the proximal tibia, and that's the biceps femoris, and this has two heads. Part of the biceps femoris arises from the ischial tuberosity, but part of it arises from the back of the femur, and they both combine together. The sciatic nerve passes deep to the biceps femoris, so it starts more lateral from where it's come out from the pelvis and then descends deep to biceps femoris before arriving in the popliteal fossa. If we focus on the medial side of the back of the thigh, we have semimembranosus and semitendinosus. These both arise, like biceps femoris, from the ischial tuberosity. They have a very similar course and action. If we just remember that semimembranosus is the more massive of the two, and it's also the more medial. Perhaps that'll help us to remember them. And the semimembranosus also has its own insertion point at the back of the upper medial tibia, whereas semitendinosus joins this thing that I keep talking about, the pes anchurinus, along with gracilis and sartorius. And those two muscles both run down the medial side at the back of the thigh and have these tendons that insert down around the upper tibia. And we can feel our hamstrings when we are sitting with the knee bent. We can feel the tendons of them, both on the medial and the lateral side. And of course, they form important boundaries of the popliteal fossa. And all of these three hamstring muscles are innervated off the sciatic nerve, directly off the sciatic nerve. And so when we test them, we are testing S2. S2 being, of course, the root value of knee flexion. Let's look at the structures that we need to know around the back of the knee, the popliteal fossa. So in this image here, I just want to go through the various things that are labelled. And I'm going to start on the left-hand side of the image with the muscles that form the superior medial border of the popliteal fossa. So we've got a number of muscles. There's actually 4 muscles here. Starting from the top, we've got gracilis. So this is the most medial of them all. This is an adductor. Then we've got semimembranosus and semitendinosus that we talked about. And then as we come down, we've got sartorius as well. Now, semimembranosus, which is the bigger of the two, semimembranosus, semitendinosus, this attaches on its own in the back of the upper tibia. But the other 3, gracilis, semitendinosus and sartorius, all combine together, and you can see that at the bottom of the image, them blending together. And they then wind round towards actually the front of the tibia, medial part of the expansion of the upper tibia, and they insert as what is known as the goose's foot or pes anchurinus, and that's 3 muscle tendons all blended together. The next label on this picture is the popliteal artery, and we can see that within the popliteal fossa, and that's a continuation, of course, of the femoral artery. It's wound round from the front through the adductor canal, and here it is as the popliteal artery, and more medial to the vein and the nerve in the back of the knee. If we look at the labels on the right of this image, from the top we've got biceps femoris, so the lateral part of the hamstrings, and that then has its tendon forming the lateral part of the popliteal fossa. Medial to this we can see the main nerve, so the sciatic nerve divides just as it enters the popliteal fossa into 2 branches. The common peroneal nerve then runs laterally just inside from the biceps femoris tendon and follows the tendon round before hooking around the neck of the fibula. The rest of what was the sciatic nerve, now the tibial nerve, goes straight down, all the way down the back of the leg before winding round on the medial side around the medial malleolus. In between the nerve and the artery, of course, we've got the popliteal vein, which is the main deep vein from lower down in the leg on its way up towards the femoral vein in the groin. Finally, at the bottom of the image, we've got the other 2 walls of the popliteal fossa of this sort of diamond-shaped structure, and those are the gastrocnemius muscle heads. So these arise from the distal femur before descending downwards as a sheet of muscle over the top of the soleus, which of course arises from the tibia and the fibula. Let's now look at the structures within the knee itself, where of course we have the medial and lateral meniscus and the anterior and posterior cruciate ligaments, as well as the medial and lateral collateral ligaments. Now the menisci are both avascular structures. They don't have any blood vessels of themselves, so they don't bleed when they're damaged, although they can produce an effusion. The medial meniscus doesn't quite form a circle, whereas the lateral meniscus nearly does. And these 2 cartilaginous structures fit around the curved shape of the distal femur, so they create the dish-type recesses that the lower end of the femur sits into. The medial meniscus is quite tightly bound to the flat ligament of the medial collateral, and often injuries of those 2 go together, as indeed do injuries of the anterior cruciate also go with medial meniscus and medial collateral. Injuries of the lateral meniscus and lateral collateral are less common. The anterior cruciate ligament arises more anteriorly, moves laterally and posteriorly to insert on the lateral femoral condyle, and the posterior cruciate ligament does the opposite, inserting on the inside of the medial femoral condyle. The anterior cruciate ligament limits the forward movement of the tibia on the femur, whereas the posterior cruciate ligament limits posterior movement of the tibia on the femur. The medial collateral, of course, prevents the lower leg moving outwards with respect to the femur, so that it avoids valgus strains, and similarly the lateral collateral prevents varus angulation of the knee. Looking at the bursae around the knee, that's these synovial bags which provide freedom of movement to moving structures, ligaments, tendons, etc. There is 4 shown in this picture, 3 of which perhaps are important that we know about. Starting at the top, the suprapatellar bursa is actually a continuation of the actual cavity of the joint itself that continues behind the patella and spreads out on either side of the quadriceps tendon. And those are the suprapatellar bursae, one on either side of the upper part of the patella. The prepatellar bursa is a distinct bursa. It's not connected to the joint at all, and it just sits in front of the patella, over the top surface of the patella, between the patella and the skin. Below the patella, the infrapatellar bursa, there are actually 2 bursae in this position. One behind the patellar tendon, which helps it to move against the bone, and one in front of it, which is the clinically more important one, between the tendon and the skin. And this is the one that becomes inflamed from constant or repeated kneeling. It's also known as clergyman's knee, and that's infrapatellar bursitis. Prepatellar bursitis is the one that becomes inflamed by in housemaid's knee, and you can imagine that a housemaid is in a more forward position than a clergyman, actually reaching forward, scrubbing the floor, and that's why you get the friction over the front of the patella rather than just below it. The 4th bursa shown in this picture is not clinically that important. It's the pes anchurinus bursa, and it's a small bursa that lies just underneath the conjoined tendon of the 3 muscles that insert just anteriorly on the medial side of the tibia. I'm now going to move on to the muscles of the lower leg, and I'm going to use a simplified approach to this. I think that there are 4 muscles anteriorly in the lower leg that we need to know about, 2 laterally, and then at the back there are 2 compartments, a deep compartment where there's 3 muscles we need to know about, and a superficial compartment with 2 muscles. So 4, 2, 3 and 2. Those are all the muscles I think we need to learn about. So coming to the anterior compartment, and they're all contained in one compartment, and they're shown in the image on the left here. There's a muscle on either side, which is an inverter of the ankle, and an everter, an outward turning muscle, and then a muscle that goes to the big toe, and a muscle that goes to the other toes. It's quite similar to what we get in the upper limb. So let's go over those. The inverter of the ankle, which is also a dorsiflexor, is tibialis anterior, and its matching opposite on the outside of the foot is peroneus tertius. It's an everter, a weak everter, but it's also a dorsiflexor of the ankle, a bit like the matching tendons that you get in the wrist that flex and extend the wrist. So those are the outer 2 of the 4. The inner 2, you've got extensor hallucis longus and extensor digitorum. So extensor hallucis longus to the big toe, you can see the big tendon here, and then extensor digitorum to the other 4 toes. All the tendons responsible for dorsiflexion of the toes. So those are the only 4 muscles we need to think about in the front. Coming to the side, you've got peroneus longus and brevis, and we'll come back to those. Then going around to the back, and this is shown in the right-hand image here, the deep layer, there's just 3 muscles we need to be aware of, and they're similar to the front, only that we don't have a muscle to match peroneus tertius on the back. So the inverter, which is also a plantiflexor, that's tibialis posterior, and then the muscles that flex the big toe and the toes, the one to the big toe is flexor hallucis longus, and the one to the other toes is flexor digitorum longus. So those are the three muscles in the deep compartment of the back of the leg. We don't need to know where they arise from, but all of the tendons run medially around the medial malleolus before going to their points of insertion. Then you've got the more superficial layer, and that's got soleus and gastrocnemius. And those two muscles both are the muscles that insert into the Achilles tendon and into the calcaneum, important anti-gravity muscles that we use in walking, pushing off, jumping, etc. Soleus arises from the back of the tibia and the fibula, and the gastrocnemius, which is a very thin muscle that runs over the top of soleus, goes above the knee joint and actually arises from the femoral condyles on each side. And of course, the two heads of gastrocnemius form the inferior borders of the popliteal fossa. In the lateral compartment, this is the fourth of the compartments in the lower leg, you've got the other two muscles, the peroneal muscles. Both of these have tendons that go around the back of the lateral malleolus and insert into bones of the foot. They are everter muscles, so they turn the ankle out, and they're very important stabilizing muscles in preventing inversion injuries of the ankle, preventing ankle sprains essentially, and protecting the ligaments, which we're going to come to in a moment. So they're important muscles in stabilizing the ankle. The longest of these, peroneus longus, from the position behind the lateral malleolus, its tendon goes right across the bottom of the foot and it inserts into the base of the first metatarsal. Peroneus brevis only goes as far as the base of the fifth metatarsal, so one on either side of the foot. And of course the peroneus brevis can pull off the base of the fifth metatarsal in an inversion injury of the ankle. This image shows the ankle from the medial side, and it's just a revision really of what we've just covered. So if we look at the tendons, the three tendons coming from the deep compartment at the back, and in fact here we can see them going through these blue coloured synovial sheaths, we've got the tendon of tibialis posterior, of flexor hallucis longus, and of flexor digitorum longus. Behind those three, we've got the Achilles tendon, which has, of course, soleus and gastrocnemius contributing to it. And then anteriorly, we can just see tibialis anterior as it comes down the front of the ankle and inserts, in fact, on the medial cuneiform just next to the first metatarsal. And then we've also got the extensor hallucis longus visible too. So it's just revision of things that we've already looked at. Here's a corresponding image seen from the lateral surface. And again, there's nothing new here, just going over the same structures. First of all, we can see the tendons from the four muscles in the anterior compartment as they go under the transverse crural ligament, more often known as the extensor retinaculum of the ankle. So we've got tibialis anterior, we've got extensor hallucis longus, we've got extensor digitorum longus, and then we've got this little muscle, peroneus tertius, coming down most laterally of those four. So those are the four muscles that go underneath the transverse crural ligament anteriorly. Then we've also got the lateral muscles, the peroneal muscles, the everters of the ankle. We've got peroneus brevis and peroneus longus. Peroneus brevis, we can see its attachment into the base of the fifth metatarsal, and peroneus longus, we can see its tendon disappearing across the sole of the foot to the base of the first metatarsal. Let's now review the bones within the foot. Now this view looks down at the right foot, and at the top the talus is highlighted in a darker colour, and that of course is the uppermost bone of the foot that fits into the mortise between the tibia and the fibula. No muscles or tendons directly attach onto the talus. Below the talus we've got the calcaneum, which of course has the attachment of the Achilles tendon and its posterior limit, and the calcaneum forms the heel and articulates anteriorly with the cuboid, and the cuboid in turn articulates with the fourth and fifth metatarsals. The talus on the top articulates anteriorly with the navicular, and then the navicular in turn articulates anteriorly with the three cuneiform bones, and they can either be referred to as first, second and third, or more often as medial, intermediate and lateral cuneiforms. The cuneiforms articulate each with its own metatarsal. So the medial cuneiform with the first metatarsal, the intermediate with the second, and the lateral with the third. And then, of course, the fourth and fifth articulate with the cuboid. The metatarsals, in turn, articulate with the phalanges. Of course, the great toe has only 2 phalanges, whereas the other 4 toes each have 3. The final subject that we're going to be looking at is that of the ligaments around the ankle. So starting off by looking at the lateral aspect, the ligaments that stabilize the ankle against inversion injuries. So there are 3 ligaments that we need to be aware of that connect the lower point of the fibula, that is the lateral malleolus, to the bones of the foot. 2 ligaments run to the talus and 1 runs down to the calcaneum. So the 2 to the talus, 1 is the anterior talofibular ligament, 1 is the posterior talofibular ligament, and then the ligament that goes down to the calcaneum is the calcaneofibular ligament. So those are the 3 ligaments on the lateral side. On the medial side of the ankle, there's just 1 ligament that we need to be aware of, which stabilizes the ankle against eversion, outward turning forces, much less commonly a source of injury. This ligament is the deltoid ligament, and it starts from the medial malleolus and then spreads out as a triangle attaching onto the bones of the foot. It actually has a complex structure with both superficial and deep parts, and it actually attaches to the navicular and to the calcaneum and to the talus. But we don't need to concern ourselves with the details. Essentially, it's the deltoid ligament that binds the lower leg on the medial side, the medial malleolus, to the foot.